Okay. Good day, everyone, and welcome to the 4th National Nursing Research Webinar. To start, we will have our national anthem and followed by invocation.
Ang pambansang awit ng Pilipinas. Kayang mag-ibig sinakalan, alam ng puso, sa titik mo'y buhay. Upang hinirang, kuya ka ng magiting, sa mandulupin, di ka pasisingil, sa nagatak tutok sa simoy at sa langit ng pangaw, ay hinatang tutla, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nagtihilig, ang bituin at araw niya kailan pamay di magtitingin. Lumalang araw ng warhagin pagsingka, buhay langit sa piling mo. Ang hindi kaya na pagkay mga api, ang mamatay ng dahil sa'yo.
Lord, you resist the proud and give grace to the humble. Help me to see the arrogance and pride that has taken my heart away from you. Remove the blindness from my eyes, that I may behold the beauty of your holiness. Incline my ears to your truth, so that I may not be deceived. Change my heart today and draw me. Draw me to your throne.
Lord, take the blindness from my eyes, all my arrogance and pride. Fill my vision with your light. Lord, take the deafness from my ears, when I'm dull and slow to hear. Help me recognize your voice. Lord, draw me nearer than before. Every day I long for more of you, to know and see your face. Lord, draw me deeper into prayer. Every day I want to meet you there, just to spend my life with you. Lord, take the darkness from my mind, when confusion makes me blind. Come renew me with your truth. Lord, take the hardness from my heart, roll away the stony part, fill me with a love that's true. Every day I long for more of you, to know and see your face. Lord, draw me deeper into prayer. Every day I want to meet you there, just to spend my life with you. Lord, take the blindness from my eyes, take the deafness from my ears, take the darkness from my mind, take the hardness from my heart.
Hello, everyone, and welcome to today's National Nursing Webinar. My name is Dr. Mida M. Morales. I'll be the host and moderator for today. I'm affiliated with Asian Hospital Medical Center as the Assistant Manager for Patient Safety and also an adjunct professor in Lyceum of the Philippines University, Batangas. Glad to be your host and moderator of the day.
And I am Christian Valdez, a registered nurse staff at Armed Forces Hospital Southern Region, Saudi Arabia, and I feel grateful for being one of the moderators of today's event.
I have few housekeeping items to cover about this presentation and the webinar platform. First, today's webinar will be available after the live session and accessible on YouTube via the Beta Nu Delta Nursing Society channel. I've also muted to avoid background noises. Nevertheless, you can unmute yourself during the question and answer session. You can use the chat button at the lower section to ask questions, and I will read it for you.
Next, we'd love to hear from you in today's presentation. Our colleagues will be joining us as panel reactors. And last, we'd like to encourage you to share today's webinar with your social networks.
Let's have a history or background with this fourth National Nursing Research Webinar, Christian. We have started this International Nursing Webinar series at the latter part of 2019. This webinar is an opportunity for Southeast Asian nurses to build relationship and to disseminate their nursing and health-related knowledge. This webinar is organized by Nursing for Humanity in partnership with Beta Nu Delta Nursing Society, in collaboration with San Beda University and Visayas State University. The main objectives of this webinar are as follows: to demonstrate and advance the nursing contribution of the Southeast Asian nurses, to support nursing contribution to the region's healthcare, and to encourage problem-solving approaches to health priority needs, to provide opportunities for an in-depth exchange of experience and expertise and beyond the international nursing community. And I'm glad to acknowledge the sponsors for today: Dr. Maria Aranas McBurney for the McBurney Grant, and Dr. Brian Vasquez for the Vasquez Grant. Thank you very much, Dr. Brian and Dr. McBurney.
We express our heartfelt gratitude for those sponsors. Today's theme for the fourth National Nursing Research Webinar, Connecting Research and Practice for Better Health Outcome, is sponsored by Beta Nu Nursing Society, Visayas State University, and San Beda University. To start our program, may I call on the Professor of San Beda University for his opening remarks, Professor Rodolph Seymour Kirby P. Martinez.
Good morning, colleague in the nursing profession and fellow seeker of knowledge. A pleasant morning to all. It is my privilege to welcome you all to the 4th National Nursing Research Webinar with the theme Connecting Research and Practice for Better Health Outcomes. This is sponsored by the Beta Nu Delta Nursing Society, Visayas State University, and the Journal of Health and Caring Sciences. The discipline and profession of nursing exists to uplift the quality of life of persons whenever they are may be. The societal contract of nursing involves the betterment of human life. That is our reason for existence. To be able to realize our social contract, research is always necessary. Discoveries from our disciplinary, professional, and clinical research enable us to elevate our practice as nurses and in the process, produce better health outcomes. This webinar aims to connect research and practice and situate how their interconnection produces better health outcome. With that being said, may you learn something from our discourse and apply those learning in your own practice. Again, welcome to the 4th National Nursing Research Webinar. Maraming salamat.
Thank you, Dr. Martinez, for that heartwarming opening remarks.
Okay, so thank you very much. It is our privilege for us to hear with their commemorative message coming from our very own, one of the Senator of the Republic of the Philippines, Honorable Ronald Bato M. De La Rosa.
First, congratulate the Beta Nu Delta Nursing Society, the College of Nursing of the Visayas State University, and the Journal of Caring and Health Sciences for the conduct of this 4th National Nursing Research Webinar. And I thank the conveners led by Mr. Joel Ray Acob for this opportunity to be part of this event. I am indeed honored. I am happy that this webinar is being held as it will further advance the nursing profession and help provide better ways to care for patients and their families. These are crucial times in the healthcare sector because of the COVID-19 pandemic, along with the continuing emergence of viruses and diseases, all of which threaten the health and lives of people. For our nation and the rest of the world to successfully address the challenges ahead, we must keep in step with the times, especially with technology and all other factors affecting our ability to win the war against the pandemic and other diseases. I, for one, am in full support of this event. I hope that the nursing community and the healthcare sector will have more of these webinars to further raise our nation's healthcare services to higher levels of performance and efficiency. As you commence this webinar, allow me to extend my well wishes to all our beloved nurses and healthcare workers across the nation and abroad. Nung ako ay nagkaroon ng COVID, ang tumulong at umalalay sa akin ay ang aking anak na isa ring nurse. At the time, kami dalawa ang may sakit, ngunit inuna niya talaga ako. Not only because I am their father, but more so, I believe, because such is the selfless nature of your profession. As frontliners in this battle against the dreaded disease, you have stood tall and courageous, never wavering in the performance of your duties to heal and save lives. Needless to say, you are indeed our modern-day heroes. As your fellow public servant, your best interests remain in my heart. At ganoon din sa mga kasamahan ko sa Senado. Hangad namin ang inyong kaligtasan at mabuting kapakanan bilang mga tagapag-alaga ng kalusugan ng ating mga kababayan. And though COVID-19 and its variants continue to threaten our population, we have triumphed in many ways as more people are now able to overcome the threats of disease, and the economy is now beginning to thrive again. Kaya naman taos-puso ang pasasalamat ko sa mga nurses at healthcare workers ng ating bansa. Ang tanging nating panalangin ay naway tuloy-tuloy ang ating pagbangon mula sa trahedya na dala ng pandemya. Tuloy-tuloy din ang hangarin namin sa Senado na isulong ang mga mabuting kapakanan ng ating healthcare workers. And as you may know by now, Senate Bill number 2421, COVID-19 Benefits and Allowances for Healthcare Workers Act of 2022 has been signed into law. Now, Republic Act number 1171, or the Public Health Emergency Benefits and Allowances for Healthcare Workers Act. With this law in place, we assure you that the government sees the risk you take every day. And for this, we all remain eternally grateful with the opening of the 19th Congress. I want to assure our nursing and healthcare community that this effort remains among my top priorities as a legislator. Hindi po namin kayo papababayaan. Alam namin na patuloy ang inyong pangangalaga sa lahat ng may sakit. Kaya patuloy din kami sa Senado. Healthcare is a never-ending effort, and we will continue to find ways to help make life better for our healthcare heroes. Let us work together for a healthier Philippines. Let us rally behind our government and unite our efforts in achieving and promoting healthier communities. Mas madali tayong magkakaahon mula sa mga hamon at problema ng bansa kung tayo ay magkapit-bisig at magkaisa sa ating mga layunin at mga gawain. With the conduct of this webinar now and more such events in the coming years, we expect a healthier and happier Philippines. Maraming salamat sa inyong serbisyo. Mabuhay kayong lahat.
Thank you very much, our senator, our beloved senator, for that heartwarming message. And we have again another commemorative message from a nurse, a president, Professor Charisma Utotalum, the president of Sulu State College.
Assalamualaikum warahmatullahi ta'ala wa barakatuh. First and foremost, congratulations on the success of your 4th National Nursing Research Webinar. As we all know, nursing research is very vital to the practice of professional nursing. It is only with exposure and experience that a nurse begins to understand the importance of nursing care. Throughout the continuous development of the world, the role of nurses has also evolved significantly. Nurses now work in a variety of settings, including the hospital, the classroom, the community, the departments, the business sectors, and laboratories. Although each role carries different responsibilities, the primary goal of a professional nurse remains the same: to be the client's advocate and provide optimum care on the basis of evidence obtained through research. As a nurse in profession, I recommend each and every one of you to involve yourself in research. Take your time to be curious and to discover a lot of things, for only this way that your learning and knowledge will continue to ponder and your skills will continue to develop. Lastly, salute to the Beta Nu Delta Nursing Society for your consistent success in your events. And it is an honor to be invited and be a part of your momentous affair. Thank you very much.
Thank you very much for that inspiring message, Professor Charisma Utotalum. Christian?
It is indeed an honor to hear from one of the senators of the Republic of the Philippines and the president of Sulu State College. So moving forward, it is my honor to present to you our keynote speaker. She is a graduate of Bachelor of Science in Nursing at Cebu Normal University At the same school, she pursued her Master of Arts in Nursing, major in Medical and Surgical Nursing. She also attained her degree of Doctor of Philosophy in Social Science Research at Leyden Normal University, followed by Doctor of Science in Nursing at Cebu Normal University. In 2015 to 2017, she became the Vice President for Research, Extension, and Publication at Cebu Normal University. She was also the Vice President for Academic Affairs in 2017 to 2022. She is presently the Graduate Studies Program Chair and the OIC at the Office of the President at Cebu Normal University. In 2011, she became the Zonal Director of the NBC 461 Faculty Evaluation and Promotion in Region 7 up to present. Since last year, she is the Commission on Higher Education Technical Evaluator in Nursing Education and Fellow American Academy of Nursing. She is also the Director of the Center for Research and Development. Let us all welcome Dr. Daisy R. Palumpon.
To our Beta Nu Delta officers and the organizers of the 4th National Nursing Research Webinar, our participants, our esteemed speakers, ladies and gentlemen, good day to one and all. Allow me to present this keynote message related to our theme, which says, Connecting Research and Practice for Better Health Outcomes. This is a very relevant theme that we have because presently, and with the advent of this pandemic for the last 2 years, we were subjected to a lot of empirical evidences that help us in determining policies and guidelines on how we address the concerns of COVID-19 for the last 3 years. And so therefore, this particular theme is very much apt when we talk about how do we attain better health outcomes from research to practice. According to Johann Wolfgang von Goethe, knowing is not enough. We must apply. Willing is not enough. We must do. In this particular framework, it presents here the presentation or the production of research. In health, in nursing particularly, we had a lot of research outputs. We have a lot of research findings. But the question is, what did we do with all these research findings that we have? It is a must that our research findings should be utilized. And how do we utilize them? It is done through practice. And in practice, we will be able to generate innovative care technologies or innovative care approaches and strategies so that we will be able to attain our health outcomes, and that is a healthy Philippines. The first question that I would like us to consider is, let's start with the end in mind. What is health outcome? According to Sidgley, health outcomes measure a change in the health status of an individual or a group which can be attributed to intervention. So if we talk about outcomes, therefore, we consider that there are particular changes in the process. It's an outcome if we talk about change in behavior, in practices, but in health outcomes, it could also be change in our health profile. Okay. Utilizing health outcomes of care will determine the impact of the process of care or intervention on the patient's life by using specific measures before and after treatment. It's very important for us to consider what is the outcome of the intervention or the management that we are doing, relating it to how do we connect research into practice so that we'll be able to attain health outcomes. We have our research findings. Then we use our research findings as basis of the intervention for the care that we provide to our patient. But the question is our nursing care intervention or innovation effective or not? And so we look into our health outcome. And that is how we utilize health outcomes as basis in determining whether the intervention or the management that we provided before and after the intervention is being done has increased the quality of health or has improved the quality of health of our patients. part of the health outcome indicators in the Philippines, not only in the Philippines, but it's a global perspective that we have, is to address the Sustainable Development Goals of 2030. So in 2015, September, the United Nations member states adopted the global plan, which is transforming our world, the 2030 Agenda for Sustainable Development. It's already 2022. And how are we in terms of addressing the SDG 2030? This SDG consists of 17 goals and 169 targets. And this allows us to stimulate people-centered and planet-sensitive change. So we can make use of the Sustainable Development Goal as basis of our health outcome. In health, we usually focus on SDG number 3, which is good health and well-being. And as nurses in the academe, we can also make use of SDG 4, which is on quality education. Although, if we look into SDG 2030, SDG 1 is the basis and the foundation of all its goals, because SDG 2 to SDG 17 are the ones that will address and improve our concerns for SDG 1, and that is eradication of poverty. In terms of the well-being of our patients or our clients, recently we have been visited by our pandemic caused by COVID-19. So here in this particular profile that we have in the advent of COVID-19 or in the surge of COVID-19, we say that the Sustainable Development Goal has not been fully attained since in 2015 to 2022. So we still have tuberculosis death, which is rising for the first time since 2005. And a lot of literatures are telling us that it could possibly be because of the resistance against immunizations or vaccines. The pandemic claimed the lives of 115,000 plus frontline healthcare workers, which also is a question of how do we attain SDG number 3 if our health workers are also reducing. We also have increasing number of measles cases in children, and also 22.7 million children missed basic vaccines in 2020. Basically, probably because of resistance, because of infodemics, or probably because of the difficulty of accessing the vaccination centers because of this pandemic. So these are some of the things that we need to look into if we talk about health outcomes. Okay, so and these health outcomes are actually very important information so that we will be stimulated and we will be motivated to work further and to do better in terms of utilizing research findings so that we'll be able to use it for practice and thereby attain our health outcomes. Now let's move on to the role of research in attaining the health outcomes. An important goal of human development research is to generate evidence to guide improvements in policies and practices. In health, we focus more on how we utilize these research findings to provide more guidance in developing health policies and practices. There is an increasing pressure to use proven approaches and to terminate strategies that do not work. And the development agencies should look to research to better understand problems, to inform decision-making, and to identify effective solutions. So keeping abreast with the new knowledge is very important, according to Haynes and Donald in 1998. We health professionals need timely, valid, and relevant information to be available at the point of decision-making. Especially this pandemic is teaching us on how to read and to utilize research findings from different countries, from different venues, and from different settings across different ages, because it's very important for us to be guided on how do we address and approach care management for this COVID-19. An important part of a learning health cycle is devoted to research, which is based upon healthcare information and provides results to inform medical decisions. Keeping abreast with the new knowledge allows data that has been called the world's most valuable resource. And in this pandemic, we learn how important databases is, we have been dependent on information from different local government units, from different agencies, because we have realized that this pandemic is not only the concern of health agencies, but is a concern of the different sectors of the government. The generation of data continues to increase faster than we seem to be able to comprehend or assimilate according to Koch. And so therefore, we use a lot of approaches. Like, for example, we believe we have what we call as data mining approaches. We have what we call as data analytics as basis of our approaches and actions in the healthcare delivery system. The third is we have the database, we have the research findings. The question is, how do we utilize them? How do we connect them to practice? And there is one very old concept, but actually still very relevant at this time. And that is translating research to practice, translational research. So when we talk about translational research, that is very, very simply said or explained as how do we utilize findings from research from bench and then applying it to actual patient practice, and that is the bedside care. So this is a very, very simplified framework of translational research. Why do we conduct translational, or why do we translate research to practice? It's because we seek to produce more meaningful, applicable results that directly benefit human health. We don't want to implement something that is not based on experimental findings, very rigid and rigorous experimental findings. That's why when we had this pandemic and there was a question of whether which of the vaccines are very effective in terms of protecting us against COVID-19. And there were a lot of researches conducted, which is very important for us in analyzing us as utilizers of these products, whether we go for this product or we go for another product from different companies that we encountered in the last 2 years that we've been in this pandemic. So it makes our findings or our approaches more meaningful if we have to translate research findings to practice. These are designed to ensure that discoveries that advance into human trials have the highest possible chance of success in terms of both safety and efficacy. Why do we translate research to practice? In the academic side, CMO 1446, series of 2012, we are asked to apply new knowledge that we generate to address specific social development problems. And the National Higher Education Research Agenda 1, or the NERO 1, is also telling us that we develop unifying theories or models which can be translated into mature technologies for the purpose of improving the quality of life of the Filipinos within the sphere of influence of academic institutions in the country. It's not true to all cases wherein hospitals are the generators of knowledge, but currently the academics are the ones that is considered as the most prolific producers of academic research and findings, which are being used now in industry. And this is now the academic industry partnership that we have engaged in. So we are expected to develop research, not because we want to just graduate in our master's or our doctoral programs or our postdoctoral programs, but because we believe that the research that we are undertaking will address community development, partnership, social development, curricular development, health development, and governance development, among others. So the research findings are there because it lends relevance to our improvement of the quality of life of the Filipino people. This is an example of a research that is being translated. This is a randomized controlled trial study on the brief psychosocial behavioral intervention with antidepressant, reducing post-stroke depression significantly more than usual care with antidepressants. So the living well with stroke and RCT. This is a study by Mitchell et al. And in this particular study, they were able, the findings of this study was made use in nurse-led intervention that decreased depression in stroke survivors. We know for a fact that stroke patients usually go to the phase of depression. And this anticipated management and care management of our nurses, these interventions were done to reduce or decrease onset of depression in stroke survivors. So from research, they were able to develop nurse-led intervention to reduce depression among stroke survivors. And they were able to implement this particular intervention in their hospital. And this is what we call as translational research. From the findings of research, we were able to apply it to practice. Now, what is the reason, or what are the reasons why there is a gap between knowing and doing? We know for a fact that in most cases we do research. And if we are going to ask ourselves, where are the findings of our research now? We report probably that I think they are in the library of our university. I think I place it somewhere in the drawer or in the aparador in our house because we need it for purposes of sentimental souvenirs or mementos. But the question is, are the findings of our research disseminated? Are they utilized? So what is the reason for the knowing-doing gap? The gap between research and practice. First, according to Ball, research findings are often inaccessible to those who need it. A lot of people probably are in need of these research findings. A lot of practitioners are probably in need of these findings, but they just can't locate the findings of our research. And what is the reason for that? It's because we only put our research, our thesis, our dissertation in the library, but we didn't have any options or opportunity to disseminate this information. And that's why at this time, we are expected to research and to publish or disseminate our findings. It's not enough that we conduct research, but we have to disseminate, to publish our research findings so that others will be able to see it by consulting Mr. Google. So another reason would be practitioners and policymakers rarely engage in research that informs their work. Most probably, we use as basis in policy development our experience. We use as basis what other people are telling us, not the marites, I hope, but those information that we gather from our stakeholders. But sometimes these are not scientific approaches of gathering and analyzing this information. So we need to go into research so that we will be able to really assume or assure the utilizers of our findings or our policy that this policy that we're making or this intervention that we're doing are really based on empirical evidence. Another reason would probably be there's no forum that exists for collaboration among educational practitioners, policymakers, and researchers. For the last years, the previous years, there's always a misinterpretation that researchers are the elite part of the academy. But actually, researchers should never be placed in a certain pedestal. They should be accessible to others, especially to the ground level, because they are the ones who are giving us scientific basis in making or developing our management practices and also our policies and guidelines. So this is very important for us. And that's why I really appreciate this webinar, because there is now the avenue for both researchers and practitioners to come together and share what we have with each other. Because as researchers, we may not know everything on the ground. We may not know what are the struggles of the practitioners and the policymakers. But once the researchers, the policymakers, and the practitioners start talking to each other, then whatever are the challenges and the struggles of the practitioners and the policymakers can be addressed by the researchers. And this way, the researchers will also be able to consult the practitioners and the policymakers in order for them to meet halfway and exchange this information, valuable information, for the improvement of our health outcomes. Remember that this is not for the good of the policymakers and the practitioners or the researchers, but this is for the good of our clients for a better health outcomes. Another would be explicit versus tacit knowledge. Evidence-based medicine is the judicious use of best available evidence combined with the experience of the clinician and preferences of the patient. Usually in evidence-based practice, there are three elements that we should consider. We have the best scientific evidence, which can be done through research. We have the patient values, how it is being perceived, or how will this practice be perceived by the patient, and the clinical experience. The explicit knowledge are those information that we get from research that are being published and we get from the literature review. But however, we also have tacit knowledge. By virtue of the experience of our clinical practitioners, there are some information that they can best answer and share compared to those which are written in the literature. And so that's why in evidence-based practice, we need three elements to be present to make it acceptable as an evidence-based practice. Not only the research findings through the best scientific evidence, but we also have to consider the clinical experience as well as the patient value. What is the buy-in of this strategy with our patients or our clients? Another challenges or other challenges that we come across why there is a gap between knowing and doing, the connection between research and practice, could be the culture of research and utilization in the institution. We might probably be in a situation wherein research is not very much considered as a priority in our institution where we are practicing. And therefore, utilization of the research findings is not also gaining its consideration. So if we have this gap between the culture of research and utilization in an institution, there will always be a gap between research and practice. Another is conceptualization and research capacity. The reason probably why there is knowing and doing gap, it's probably because of the fact that in terms of the conceptualization, the researcher's conceptualization is only on the tip of the iceberg, but the researcher have not seen the deeper reason behind the practices or the changes in the practices, the disruptions in the practices that we have, or the disruptions of the health outcomes that we have. And so therefore, the connection or the collaboration of the researcher to that of the practitioner or the policymaker will really bridge and narrow the gap between knowing and doing. Or probably there is a lack of alignment between the research purposes and the needs of clinical professionals and those in charge of policy. This is really very true. Sometimes the researcher is not grounded on what's really the problem. Okay, and so therefore, we only research on what is it that we thought are most relevant on our perspective. But however, we have not seen the perspectives of those in the clinical practice. Probably what they want to know is a different thing from what we have understood that it is. And so again, collaboration is very important. Another is large data analytics and interpretation. There are a lot of information that we get from the internet, from our subscriptions in different research journals, the e-journals that we have in our libraries, in school or hospitals and other institutions. But there is a need for us to also validate the information. That's why the Evidence-Based Practice Committee has a very good role in determining and validating whether the findings of this research is really applicable and is supported with big data or data analytics. So this also will put a delay in the utilization of research to practice. The other one is the three-way tug of war, the institutional vision and programs. It's a question of whether we put research in the university's perspective, or in the industry's perspective, or in the government's perspective. But the thing there is, this should not be considered as a tug of war, but this should be more of a collaboration. This should be more of a partnership. If the government is in need of information, then they can tap the university. If the industry is in need of research assistance, the university can provide it with them. And another thing would be the findings could be utilized by the industry. The findings of the studies conducted by the academe or the university can be utilized by the industry. And this could also be disseminated to the government, because private industries are not the policy development team of the entire country, but it's really the government. So the university has to share it to the practitioners in the industry and to the policymakers in the government. And this is very important, that our university should have the vision and the programs towards research-related information and assistance to our partners in the industry and the government. And what are the strategies to connect the gap? First, include key stakeholders in research to increase the likelihood of producing useful research findings. In the conceptualization phase, we are allowed as researchers to talk, to interview the stakeholders on that particular problem that we have in mind, so that we will be able to understand what is really the perspectives of this problem among stakeholders, or those people who are affected by these problems. It's very important for us to engage them in our conceptualization of the study. That's why we have what we call as the participative action research, or the PAR, because the PAR is a very important strategy when we include stakeholders, the ones who are really experiencing the problem in our research process. So they can be part of the conceptualization, they can even be part in the methodology development, and also in the data gathering and analysis. So that's a very empowering approach to connect research and practice. The other one is design and evaluate pilot projects to enhance the potential for future replication and scale up. When we develop our research, please be very specific, and if possible, make it clear in the steps, in the methodology, because that's where validation of the study for evidence-based practice starts in the first place. These are areas where we would like to look into, so that we will be able to understand, oh, okay, these are the steps, the methodology of the research that they have conducted. But why are they using non-probability sampling? Why are they using probability sampling? Why is it that the findings are only in this part? And probably because of the methodology, which is very superficial. So these are things that we have to look into, to design and evaluate pilot projects that will enhance potential for future replication. The third could be develop and implement a plan for disseminating research findings to key audiences. It's not only conceptualization, data gathering, analysis, but we also have to plan for disseminating our research findings. And it is very important that when we disseminate, we will be able to capture their buy-in to our intervention that we are proposing. So that's why it's not only a one-shot deal. It's actually a process that we have to develop, so that other agencies will be able to know, to learn that this university or this research is being done. And so therefore, if the need for this information arise in the government agency or other industries, we know where to go in terms of accessing information. Another is advocate policy changes that will facilitate the widespread use of evidence-based practices. Okay, it's very important that we use evidence-based in policy development as well. Okay, so that's why we learn a very hard lesson in this pandemic. It's not enough that we just think of a strategy on how to address interventions in the different local government units, but it should also make use of databases so that we will know where to go. Is the case of COVID-19 increasing or decreasing? So like currently our COVID cases is increasing, the positivity rate is increasing, but however, the vaccination rate is also increasing. And so therefore, just recently, the Commission on Higher Education announced that we are allowed now to go on full face-to-face. Okay, so this is what we call as a policy change that advocates evidence-based. Then another strategy will be to engage champions to increase the likelihood that a new or underused evidence-based practice will become the standard. We need champions. Like in COVID-19, we had champions who were the task force, the interagency task force, and other champions in the different LGUs and government agencies who are really doing the frontline activities, monitoring of these activities, because these champions will allow us or will help us in navigating the complexities of human problems and concerns that we have along the way. So we engage champions. It's very important that these champions are there because they are actually the influencers. And these influencers will be basing their media platform or their content on evidence-based practice, not based on infodemics or fake news. The sixth strategy would be negative findings warrant careful exploration. Sometimes when we conduct research, there are findings that will tell us that the relationship is not significant. The difference is not significant. Don't you know that these findings can also provide us as outliers and very important ways of interpreting for policy development? Whether the research failed to find an effect as a result of program design, implementation, evaluation, we have to ask ourselves, why? Why is it that in the evaluation of this project implementation or the program implementation, it failed? And the answer to our whys are very important inputs for us to improve our program implementation and development. What are the future considerations that we have to consider according to Patricia Grady? First, as researchers, as practitioners, we pursue new ways of thinking and working. Gone are the days that tells us that only those who love research will utilize research findings. But as practitioners, it is a must that any innovations or any new practices or implementations or management that we are doing should go through research, should be based on research findings, and should be evaluated through research. Another is educate, educate, educate. We need to educate people. We need to be disseminators of research findings. We need to educate people that research is not something that we should be afraid of, but research is something that will help us along the way. Then the last would be changing our values. Do not work alone, because research is not a solitary job. It is done by teamwork. Researchers should collaborate with practitioners and policy developers so that the findings of our research will gain more attention and will gain their perspectives or position on which agencies or what sectors can make use of the findings of our study. So again, I would like to go back to this feedback loop mechanism of research, practice, and outcomes. We conduct research as a driver of the practice that we have, and so that through this, we will be able to have a better and healthy Philippines. So we use, these are my references. Thank you very much. And remember that research is a friend. Research is something that we can always use. The findings are something that we can always make use of towards a better and healthy Philippines. Thank you very much, and God bless us all.
Currently, that was an informative keynote address. Meanwhile, in achieving positive health outcomes, it requires research that directs applications towards practice. Indeed, knowing is not enough, we must apply. Willing is not enough, we must do by Joanne. Once again, thank you, Dr. Daisy R. Palumpon.
Okay,
Topics.
thank you very much, Sir Christian. So before we proceed to our presentation, I want to have these to share these takeaways from Dr. Daisy Palumpon. We should ace it. We should ace it. A is accessibility. Accessibility in terms of the generation of new knowledge, accessibility of our results, and also accessibility of our recommendation to our stakeholders. We have C. C is collaboration. Dr. Daisy had been mentioning collaboration in the different facets of learning, such as from the education part, clinical practice, and even the industry-driven organization. And last is engagement. Fellow nurses, educators, clinicians, students, let's ensure that we are engaged. Research is a way of life. And through this translational research, we will ace it, okay, for us to achieve a healthy Philippines and a healthy world. So now let's proceed to our presentations. First, our first presenter is a graduate of Bachelor of Science in Nursing at Notre Dame of Marble University in 2006, receiving the Clinical Efficiency Award. He graduated his Master of Arts in Nursing in the year 2012 at San Pedro College, Davao City, and received the Best in Research Award. He also graduated with his Doctor of Philosophy in Nursing at San Pedro College, Davao City in year 2021. Recently, he published a systematic review article in the International Journal of Health and Current Research. The Dean of Nursing at Notre Dame of Tacurong College is also the Governor of Philippine Nurse Association Region 12 to present his study entitled The Study of Muslim Maguindanaoan Culture, Basis for Culturally Congruent Nursing Education. Let us welcome Dr. Elmer G. Organia.
Good day, everyone. I am honored to share with you my research entitled The Study of Muslim Maguindanaoan Culture, Basis for Culturally Congruent Nursing Education. I am Dr. Elmer G. Organia. This study is inspired by the theories Madeline Weininger in her theory Transcultural Nursing. For her, the application of transcultural nursing is essential, especially in transitioning into an increasingly multicultural society. Muslims are composed of around 1.8 billion people and are considered the second largest religion after Christianity. Because of this, the possibility of having conquered them is very high, and as a result, the way they are being dealt with may provide challenges, especially for those unfamiliar with culture. According to Murunda 2019, student nurses coming from different cultures need caring and understanding, and this changing diversity among students brings in unique needs. This study was conducted to deepen the understanding among non-Muslims of the Islamic culture through Muslim Maguindanaoan student nurses' voices. This will also address issues of discrimination in a Catholic school. Specifically, this will ensure a conducive learning environment for minority student nurses provided by culturally competent faculty. The findings of the study were used as a framework to develop a culturally congruent nursing education for Muslim Maguindanaoan student nurses. This study used a qualitative phenomenological research design and was conducted in a Catholic institution. The setting is bounded in the north by the province of Maguindanao, where most Muslim student nurses reside. Pure Muslim Maguindanaoan student nurses were taken as participants, and the data were analyzed using Polachi process of phenomenological data analysis. The results revealed 5 emergent themes. First, cultural practices and traditions of Muslim Maguindanaon family. Second, experience of acceptance, respect, and supportive school community. Third, student organizations, social networks for relevant Islamic activities. Fourth, the curriculum and instructions with considerations of the Muslim Maguindanaon culture. And the last emergent theme, a Catholic school delivers quality education while respecting the diversity of Muslim Maguindanaon students. The sub-themes are also presented. The results revealed that the Maguindanaon family is usually an extended family with strong connections. They also value being called by or datu, respect for other cultures, modesty, generosity, and loyalty to Islam. They also believe in folk healers similar to different cultures. In terms of relationships, opposite and same-sex relationships are viewed differently by the participants. For some, it is acceptable, but not for others. In terms of marriage, the participants also have opposing views about early marriage, parental consent, and marrying while studying. For communication, it includes the preferred language in communicating, touch, and eye contact. Wearing of hijab and long dress is an obligation of Muslim Maguindanaoan women. However, school policies hinder them from practicing, especially during related learning experiences or RLE. They also developed strategies and requested that they wear the hijab during clinical and community exposures. The Muslim Maguindanaoan are prayerful and they would want to pray even they are in school. The participants are eager to pray, especially during Friday. The participants also experience great support from their classmates and instructors. They said that their classmates are allowing them to pray in the classroom without disturbing them. The instructors also excuse the Muslim Maguindanaoan students to pray if they have scheduled classes. The Muslim Maguindanaoan participants are conscious of the food they eat. They express the cultural restrictions, their experience eating with Christians, their experiences during fasting, the services in the school canteen, and considerations they receive from their classmates and instructors. The Muslim Maguindanaoan students find a school home and experience acceptance, respect, and a supportive school community. However, some participants experienced isolated discrimination and felt being left out initially. The Muslim Student Organization conducts relevant Islamic activities and provides opportunities for Muslim students to organize. They also experience cultural considerations during school activities, where the Muslim culture is showcased in various institutional activities. They also emphasize that celebrating the Christmas party is forbidden for Islam, and they suggested activities to improve cultural awareness in school. The participants value quality education offered in a Catholic school. In their clinical exposures, the Muslim Maguindanaoan has different opinions about assisting in culturally restricted surgeries. They also value the elderly and willing to understand patients despite differences in culture and beliefs. During lecture classes, they also express several reactions to the discussion of sensitive topics in class. They also emphasize that some subjects integrate topics about Muslim culture and their instructors provide considerations to them and expressing fair treatment. The results of the study serve as basis of 4 outputs or frameworks. The first output is the culturally congruent nursing education model. This model is a visual guide that depicts a Muslim Maguindanaoan student nurses' experiences in a Catholic school. The student nurses carry their cultural identity before they enroll in a Catholic institution. Meanwhile, the school has its own identity through its mission and vision that needs to be maintained and achieved while responding to the students' diverse cultural needs. As a result, the Muslim Maguindanaon students experience challenges related to their cultural beliefs and practices. This model is inspired by Leininger's Sunrise Enabler. This culturally congruent nursing education model is designed to deliver culturally congruent nursing education for student nurses through the mapping of the program outcomes, prototype curriculum, educator's guide, and relevant programs and activities. This model can provide quality nursing education with careful considerations of the Muslim Maguindanaon culture. The 5 emergent themes that evolved from this study are now considered essential factors in this framework in delivering culturally congruent nursing education. The second output is the BSN prototype curriculum integrating Islamic studies subjects and transcultural nursing. The following subjects can be included in the curriculum as a replacement for the religious education subjects. We have history of Islam, life and teachings of Prophet Muhammad, Islam morality and responsible parenthood, religions of the world with peace education, and transcultural nursing. The third output is the integration of culturally congruent nursing education in the curriculum map. And lastly, the fourth output is the Educator's Guide for Muslim Maguindanaon students. This guide aims to help educators be aware and responsive to specific accommodations for Muslim Maguindanaon students in practicing their values and beliefs. Based on the findings of the study, it is recommended that the school administration should intensify the use of the framework for culturally congruent nursing education. The nursing faculties shall review the curriculum, strengthen their capacity to respond to culturally diverse students' needs, and the Commission on Higher Education may encourage schools to integrate transcultural nursing subject to respond to the needs of Muslim Maguindanaon students. In nursing education, nursing schools may use innovative approaches to provide a culturally responsive environment. In nursing practice, nurse practitioners will respect the diverse culture of the student nurses, and in nursing research, more intensive studies on instructors' experiences in responding to diverse students' cultural needs.
Okay, thank you very much, Dr. Elmer, to that. So some of my takeaways in your paper before we proceed to the second presenter is the inclusivity. And later, I will have some questions regarding your challenges and how did you overcome these challenges. Thank you very much, Dr. Elmer. So now let's proceed to the second presenter, Sir Christian.
Thank you, Doc Mix. The next presenter is a graduate of Bachelor of Science in Nursing at Notre Dame University, Cotabato City. She pursued her Master of Arts in Nursing at San Pedro College, Davao City, followed by Doctor of Philosophy at the same college. In 1998 to 2002, she worked as a NICU nurse at Maternity and Children's Hospital at Medina Al Munawara, Saudi Arabia. In 2002 to 2005, she was an OB nurse at Riyadh Medical Complex, Saudi Arabia. In 2020, she started working as a program head at the College of Health Sciences up to present. Once again, a native Maguindanaoan and is always interested to study about her culture because of its unique characteristics. Let us all welcome Dr. Mary Jane K. Balawag.
Assalamualaikum warahmatullahi wabarakatuh. We always begin our greetings with peace be upon you, hoping that everyone is well. But before I will begin, allow me to express my heartfelt gratitude to Sir Jerome Babate for encouraging me and recommending me to present my dissertation paper in this prestigious event. Sir, thank you very much. And thank you also, Beta New Nursing Society, for this opportunity. So the title of my paper is End of Life Care for Maguindanaoan Patient. the non-Muslim nurses experience. Death and dying are universal human experiences, yet human beliefs, feelings, and practices regarding this vary widely between different religions and cultures. Okay. Providing culturally competent care in clinical practice, according to Bebenishti 2004, can also be very challenging. Hence, coping with differences in culture is becoming a major healthcare issue. Intercultural competence can be taught, but personality factors can also affect levels of intercultural competence that individuals can attain. Healthcare provider may be challenged also with patients' cultural norms, which differ from them, particularly around end-of-life care. And this can impact provision of quality of end-of-life care, according again to Colin 2012. There are international studies on end-of-life care for Muslim patients conducted in Middle East and Gulf area. Yet, little is known about how non-Muslim nurses in Mindanao provide nursing care to dying Maguindanao patients. In fact, available references accessible were conducted by Fontanilla and Taloma in 1997, as well as Glang and Convocar in 1978, which mostly talk about Maguindanaoan way of life, which includes burial practices. However, the study did not focus on nursing care, but describe the process involved in burying the dead. So it is hoped, therefore, that study would provide more insights and understanding quality end-of-life care of non-Muslim nurses in caring for dying Maguindanaoan patients. After all, providing excellent care for dying patients is something all patients deserve. So it is important to remember that most patients want to prepare for death, if possible, according to Chiplasky, 2009. Now, the intent of the study was to explore the experiences of non-Muslim nurses in caring for dying Maguindanaoan patients in an intensive care setting. The study attempted to describe the meaning of experiences, the difficulties, and the challenges the non-Muslim nurses encountered as they provide this end-of-life care by attaining peaceful and a dignified death within the Islamic context. For the methods, for design, I have actually employed qualitative in orientation and phenomenological in approach, specifically exploratory descriptive design. Setting is Cotabato Regional Medical Center. Participants, 7 non-Muslim nurses assigned in medical intensive care unit of CRMC. Okay, they have at least 1 to 3 years experience caring of Maguindanaoan patients. Instrumentation, one-on-one, in-depth interview or intensive interviewing with the respondents. Okay. Ethical considerations, obtain approval from Research Ethics Board of CRC. Now for the results of the study, but before that, framework of analysis. I have adopted thematic analysis as my framework, using polysis, phenomenological, or methodological interpretation. The transcripts and field notes were analyzed for common themes and patterns which were used to gain a better understanding of the experience of the non-Muslim nurses. Caring was identified by reading through each transcript and underlining important phrases. The transcripts were read multiple times to ensure that the full experience of the providing care to dying Muslim patients was obtained. The data were then grouped into meaningful clusters and themes. A matrix was also used to present the thematic analysis of the study. Okay. So 2 themes came out on the definition of death and perception on peaceful death. Okay. One is death is an inevitable end and a new beginning, and also absence of pain. So through the participants' perspective, death is a period in which one's life that ends the biological and physiological processes in our body. However, the spirit or the soul will continue to live, which suggests the beginning of an eternal. Participants also shared in the study that their patients who died peacefully are those who resemble sleeping and no mass of pain or struggle that are reflected on their faces. There are patients also, they said, who are really in pain with facial grimace, which shows the imminence of impending death. Painful to look at, but participants verbalize helplessness and powerlessness to lessen the pain experienced during that crucial stage. Okay, there were 10 themes that depict the end-of-life care of the participants. Equal patient care, family support, spiritual care, becoming culturally competent, relentless commitment, guilt feeling, brave enough to confront, speak the language to communicate, physical care, and experience of self-fulfillment. Now, what is the knowledge generated out from this paper? Drawing from the results of the study with its emerging theme, which is presented here, themes extracted from the experiences and narratives of the 7 non-Muslim nurses at the ICU revealed the unfolding of a world view of a non-Muslim nurses to the processes involving how and why of caring in their effort to provide optimum end-of-life care. The first box explained the definition of the death and perception of the non-Muslim nurses towards peaceful death. They define death as inevitable end and a new beginning as well as absence of pain. The second box now describes the confidence that in order to deliver an optimum end-of-life care to Maguindanao patients, the nurse must render relentless commitment. This implies a deeper sense of connection of the nurse with the patient and his or her family during the difficult period in their life. So the third box portrays the end-of-life care of the participants spelled out into 8 themes. We have the family support, equal patient care, spiritual care, becoming culturally competent, guilt feeling, physical care, speak the language to communicate, and brave enough to confront. Okay. So these 8 themes taken from the narratives of the 7 non-Muslim nurses. And this box explained also, the last box explained the understanding of the participants of their experiences as they provide quality end-of-life care to their Maguindanao patients, wherein they consider the experience as a form of self-fulfillment. They were happy of the fact that they were given opportunity to use their talents in order to touch other people's lives. Caring and sharing tender moments with the patients and their family was completely rewarding for these nurses. So the interplay among the factors, which are the extracted themes, gives us a perspective that end-of-life care form of caring is quite different and more complex from the nurse caring for non-dying terminally ill patients, especially to patients with diverse culture. So summary of the implications. Communication skills are the basis in providing supportive end-of-life experiences, which communicates a plethora of information to family members. Nursing curriculum will also emphasize in their program concept of cultural competency, death and dying, and medical anthropology, especially in the aspect of end-of-life care. The practical view of the situation of the dying patients and family is better than staying ideal because idealism is interpreted as disrespectful to the Maguindanaon or Muslim beliefs and culture, and produce a standard end-of-life guidelines for all hospitals, especially in Cotabato City. So it is believed that these guidelines will help improve the end-of-life care practices of both Muslim and non-Muslim nurses in BARM and Mindanao region. So in the nursing profession, providing end-of-life care can be quite complex role for a nurse and at times subjective in nature. It cannot be overemphasized that caring for dying Some nurses are better prepared for this role, others are not, recognizing the fact that caring for the dying is riddled with ethical concerns and cultural issues. So dealing with death and dying is something nurses have to be prepared for as they perform their tasks at ICU. The situation is accompanied by emotional, psychological, and physical and spiritual dimensions of care. So here, with the conclusion, the study revealed that among the 7 participants of the study, it is not quite easy to accept that one's patient dies while under his or her care because non-Muslim nurses look at this as a form of failure. So the perspective for caring for dying lies both within the domain the nurse assumed professional care provider, which includes the expected role, the technical and mechanical aspect, and also the care provider who embodies the other aspect or elements of caring which I mentioned earlier on the knowledge generated. So as they provide care to dying Maguindanao patient ICU, they also do not have to regard or they do not regard differences in beliefs, practices, and culture of the patient under their care. So I think that would be all. Thank you very much for listening and have a great day, everyone.
Thank you, Dr. Mary Jane Balawak, for an interesting presentation. Indeed, death is an inevitable human experience in which an end-of-life care must be considered. So before we are going to proceed to the next part of this program, Doc Mix, do you have something to add?
Okay. So that is inevitable, but we as nurses, we are handling our patient from womb to tomb, and it is our process of dealing with this end-of-life care and very specific to culture, no, of the non-Muslim nurses' experiences. Thank you, Doc Mary Jane. And now, let's proceed to our open forum. May I ask our keynote speaker, Doc Daisy Palompon, our presenter, Doc Elmer, and Doc Mary Jane, to our virtual stage. Good day, everybody. So let's start our question and answer. Doc Daisy, yes, a very fruitful and very enlightening session with you, Doc Daisy Palumpon, regarding the translational research. So let's start. So for my first question, regarding Doc Elmer's research, what's your inspiration in conducting this cultural sensitive topic of conducting a Muslim Magandaraon culture in the context of Catholic school? So it's very challenging. Can you share this, Doc? Thank you.
Thank you, Dr. Morales, and good morning, everyone. Actually, my motivation to conduct this study is the frequent visit of these Muslim Magandaraon students in my office. Almost every month, some students visit my office for some concerns regarding their hijab, because some of the students cannot really afford to remove their hijab while having their duty in the hospitals or even during our early hours. And it's also challenging on their part, and I can really see that it's difficult for them to do it. Another concern raised was about the schedule of their classes. Sometimes during Friday, they have scheduled classes, and some of the students want to pray, and sometimes they are in a difficult situation, whether they are excused or not excused to do that. And another one, especially during December, some students prefer not to join the Christmas party, because we know in a Catholic school, most students are really excited to celebrate exchange of gifts and other activities. But I can observe that some students are resistant, and some of them visited my office to excuse them in joining this party. And of course, the halal food. Sometimes some of them are complaining how this food are being prepared, especially when we're having our hospital duties outside our school. And because of these reasons, I want to explore these experiences for me to understand them better, their culture also, and for us to respond to these challenges so that it will not be difficult on their part as they thrive and practice their traditions and beliefs in a Catholic school. Because we know, as mentioned a while ago, they are in a tug of war situation also between their culture and of course the school has its own mission and vision, the goals of course, and these are Catholic schools also, and we want to respond halfway without compromising the goals of the school, at the same time the values and beliefs of these student nurses.
Okay, thank you very much, Doc Elmer. Some of my takeaways to that answer is inclusivity and respect. So in terms of us in the nursing clinical or administrative level in the industry, we appreciate your paper because it shortens the gap, because it's not only academe to practice, but it's also religion. Religion, faith could affect health outcomes. Would you
Yeah.
believe? Do you agree with this? Because as we have also some Muslim nurses,
Yeah.
and the nursing administrators should also adapt to the needs of these nurses, because these nurses will be the one who will care to our patients. If
Yes.
and you start from nursing education. Thank you very
Yes.
much to that. And may I ask also, Doc Mary Jane, so what's your inspiration? Because these topics is very, what you call this? It's very rare of having a conversation about end of life. It's very taboo in the Philippines, but your paper is end of life care. So can you share about your motivation or rationale? Thank you, Dr. Mary Jane.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First and foremost, no, with this paper, kasi it was conducted years before. I was really touched by what our keynote speaker have said before, that the knowing gap, the application. So this might be quite late, but at least, alhamdulillah, I have the chance to present. Now, what is my motivation for coming this paper? I think it's because for me, no, I'm a native Maguindanaoan. So I know that for my culture, that can be biased, but for my culture, kasi I want to really show to the world what the unique characteristic of my culture as a Maguindanaoan native. And at the same time, this is also a motivation for me, starting from my master's, because my master's also related somehow with Maguindanaoan, and it's talk about disciplinary practices of Maguindanaoan. Okay, how do they deliver? I mean, discipline their children. Okay, based on their perspective. So I think that's really the reason why. So when I had this paper or concept in mind, I started to continue that, no? Kasi before, that's not about disciplinary practices. So with this one, it's talking about how a Maguindanaoan patient would have to respond to a non-Muslim nurse taking care of them. There are so many reservations on their part, no? That's how I think the reason why really motivated me in coming up with this kind of paper. And this is really somehow a very good what we call this, a venue, no, for them to for us, no, as Maguindanaoan nurse, to understand also the perspective of non-Muslim nurses in caring for a Maguindanaoan patient. So that's really my motivations of coming up with this paper.
Okay, so thank you very much. Again, inclusivity and open-mindedness and cultural sensitive approach. So I want to read the question from Doc Daisy. Is there any technique in finding the right research method for your study? From Merlin Tayo. So probably, Doc, you can answer it live for it
Yes.
to be shared. Thank you,
Okay.
Doc.
Thank you, Doc Mig. Good morning, everyone. And although I have answered it already online, but let me just reiterate my answer to the question, is there a technique in finding the right research method for your study? Actually, the basics among all, if you want to know what's the best research method for your study, is to look into the intentions of your study, the objective of your study. If the study intends to look into the experiences, the in-depth understanding and meaning of the experiences, so you can go for qualitative research. But if your intent is to only consider what is the level of stress and so on, then you can go into qualitative research. And if it's more on effectiveness of an intervention, then you can proceed with experimental research method. So these are some of the things that you have to look into. Basically, look into the objective or the intention of your study, and the rest of the other factors will follow in terms of the feasibility in the conduct of your study.
Okay, thank you very much, Doc Daisy. Maraming salamat. So I totally agree with you that it depends on the objectives and the title of your paper, and also the expertise of the researcher. Okay, please be honest to yourself. If you're not expert at the specific phenomenology, ethnography, please seek advice to the experts. Okay, so there are a question probably to our presenters. We are in the 21st century. Do religion have significance or impact in the delivering healthcare, specifically in nursing field? Is it that the standard of practice knows no gender nor religion? From Hernando Jr. Bernal. Doc Elmer or Doc Mary Jane?
Thank you for that question, Dr. Morales. I agree that we have standards in the delivery of our services and care to our patients. But as we transition into 21st century, we are also transitioning into inclusivity, and we are accommodating diversity. And with that, we are expanding our knowledge to explore new ideas, the least explored concepts and phenomenon are being explored now for us to deliver inclusive care. That is why the landscape of nursing care is also transitioning, and that is part of growing as a profession. So we are expanding, we are exploring, and we are responding to diverse needs because we want that every need is being responded. So thank you.
Thank you, Doc Elmer. Doc Mary Jane?
I think I would also agree with Dr. Arganya, no, regarding the exclusivity that we have to consider, no, because we are talking about different cultures here, and we have also to understand that there might some instances that they would be so sensitive. And then we know as a nurse, we have to know how we respond to that particular issue, that not also trying to determine what's the standard of care and what's also respecting also what they need. No, so I think we have to really understand this issue in order to give a culturally competent care. No, so that's, I think, the reason. Okay.
Okay, thank you very much, Dr. Mary Jane. Dr. Daisy, do you want to have an input regarding this?
Yeah, I think there are two perspectives that we have to look into, aside from the fact that it was mentioned that education and practice now is considering inclusiveness and also, most importantly, non-discrimination, both of the practitioner and at the same time of our clients. So, but however, there is also in education, we also have to consider that there is also a need for us to respect beliefs and practices of our students who will be our future practitioners. Like, for example, in the case of the study of Doc Elmer, we have here potential or future practitioners who are Muslims. And these practitioners also have their own beliefs and practices. Now, as practitioners, I believe that we have to respect the beliefs and practices of the nurses. At the same time, the nurses, whether they are of different beliefs and practices from their clients, they should also respect the needs of the client. So on the study of Doc Elmer, I think the focus is more on the practitioner, on the future practitioner, on the nurses. And how education or academe has to address the needs of our students. So actually, at this time, we have to be very much aware of the fact that we should not only look into the needs of the majority, but we also have to look into the minority perspectives as well. And I really appreciate on the way it was handled by the school of Doc Elmer. Although there is a contrast with the vision and mission of the school, but because we think or we always practice non-discrimination of our students, and so therefore we also have to accommodate them in the same way that in our university, which is a state university, a government institution, we also have our students who have different religions and practices, and we come halfway but as long as there is no compromise with the quality and excellence of their education. Okay, on the part of the clients, these future practitioners whom we respected at the time that they were with us in the academy, we hope and pray that they will also be the ones who will be respecting their clients in the future.
Okay, so thank you very much, Doc Daisy. I totally agree that in part of the industry, in the clinical setting, we respect, okay, all. And we also observe the standards of care. However, we should see the patient as a whole. In biopsychosocial model, as a person, they have their own culture. They have their own practices. That if our nurses are trained in the academy to be sensitive, culturally sensitive enough, thus they can care in a manner that we respect the patient, but not compromising the quality of care. I totally agree with this. But it should start from the basics, okay? And we should also respect their opinion. If they do not want to handle these patients, we should respect that in the part of the administration. Because as a person, nurses are human beings. Nurses have own beliefs and practices. If it's not congruent with their beliefs, so it's not healthy to them. So again, in the practice of nursing, it's not only satisfying the patient's needs, but also satisfying our internal client, our nurses, and our student nurses. Okay, thank you very much. So there are questions, Doc Daisy, regarding the sole. I would like to ask Doc Daisy about the sole authorship as criteria for professional rank on the NBC.
Yes, okay. Yeah. Thank you, Doc Mig. I think it's in relation with faculty promotion in state universities and colleges. It's mentioned here that there is a guideline on professorial accreditation on sole authorship. But I would like to request this proponent of this question. I would like to inform the proponent of this question that PASOK guidelines on professorial accreditation requires only main authorship in published papers in indexed journals, and sole authorship is not a requirement for professorial accreditation, because we always consider that in the conduct of research, we have what we call as collaborative research, and there are also and we are also required to implement and utilize our study for social development, academic, among others. So in this case, I think there's a need for us to go back not to the guidelines. Kindly check on the guidelines, because the guidelines that we are using as of this time is main authorship, not sole authorship. But there's no question if you will go for a sole authorship in your research paper. What I meant when I say participative action research, collaboration and research, you may be one author, but your work includes collaboration with other partners, like in the community, or student engagement, among others. So there's no question on the sole authorship. If you want to go for research on sole authorship and you want to publish it in your own, but in the process of the conduct of research, you do not do it on your own. You also engage other, like the informants or the participants that we have in our study, and even administrative support for areas where we conduct our study. So again, for professorial accreditation, please review, because the guideline says main authorship, not sole authorship. Thank you.
Thank you very much, Dr. Daisy. In the interest of time, so thank you very much for our presenters and our keynote speaker. And now let's proceed to our awarding of certificate. So for our certificate, so let's give a warm round of applause to our keynote speaker, Dr. Daisy R. Palompon. So may I read the citation? Beta Nu Delta Nursing Society, Visayas State University, and Journal of Health and Caring Sciences. Certificate of recognition is given to Dr. Daisy Regis Panompon for sharing her invaluable expertise as a keynote speaker in the 4th National Nursing Research Webinar held on 10th of September 2022, signed by Dr. Rudolph Seymour Kirby Martinez, the convener, and Dr. Joel Acob, also convener. Again, let's give a warm virtual applause to Dr. Daisy Palompon.
Thank you very much. Maraming salamat po.
Maraming salamat. Thank you. And now let's proceed for the presentation of certificate to our presenters. Certificate of recognition is given to Dr. Elmer Ergania for sharing his study as a presenter in the 4th National Nursing Research Webinar held on the 10th of September 2022, signed by Dr. Martinez and Dr. Acob. Let's give a virtual applause to Dr. Elmer.
Thank you po.
Same certificate are given to Dr. Mary Jane K. Balawag. Thank you, Dr. Mary Jane.
Thank you po.
So probably before the closure, can we have a photo opportunity for the panelists? Okay. Our panel, okay. Can you open your camera? Let's have a picture taking. Doc Martinez, Sir Christian, Doc Rick. Okay. So, yeah. Okay.
Sir Mix, can you do the screen sharing since I'm picture since I'm screen sharing at the moment.
Okay, thank you, Doc. Thank you. Wait a minute. Okay, smile. 1, 2, 3. Another one. Okay. So thank you very much. So now let's proceed to our closing remarks. Sir Christian.
Okay, so for the closing remarks, we'd like to call on the Dean of the College of Nursing at Visayas State University, Dr. Joel Ray Acob.
Good morning, everyone. I'd like to correct that I'm no longer the Dean of the College of Nursing for the Visayas State University. But then again, I bring greetings in the name of the College of Nursing of the Visayas State, as well as with the Beta Nu Delta and the other organizers for this national webinar. I am grateful to all of you joining online and on this endeavor that you become instrumental in the realizations of this year's national research webinar. The nursing being a very dynamic profession has been affected with the unceasing change and the demands of time as well. And the presenters emphasized the connection of the evidences, its efforts to better the health delivery, and the connection of this to outcomes and programs, which would later inspire research enthusiasts and clinicians to endure their engagement in the knowledge search through research process. To all the presenters and our keynote speaker, Dr. Daisy, accept our gratitude for being with us in this search for advancing the line of knowledge dissemination to our colleagues in this caring-based response profession. I know how busy you all are in your respective callings. However, you dedicated time to dedicate attention, especially on the pressing needs of finding links between the practice from the research endeavors. So as we move forward for the better, it is with optimism that the shared knowledge becomes our input to all of us as we continue with our search to be agents of healthcare reforms. It is not happening overnight, but may this serve as our motivation to generate more sound and ethical research proposals, agenda, which has something to do with our thrusts. Finally, to our organizers and partners, our attendees, both here and abroad, the engagements were truly commendable, and it is with hope that we'll be seeing you all and be working with you all in the years to come. That being said, thank you and continued success.
Okay, thank you very much, Doc Acob. So now, let's proceed to the recognition of our sponsors and also the organizers. So, certificate of recognition is given to Dr. Joel Ray Acob for the co-convener in the 4th National Nursing Research Webinar, signed by Dr. Rudolph Martinez. Okay, CERM certificate are given to Dr. Rudolph Seymour Kirby Martinez as a co-convener this 4th National Nursing Research Webinar, this 10th of September 2022. Okay, same certificate, yours truly. Thank you very much for this opportunity as your host and moderator of the day. Certificate of recognition is also given to Sir Christian Valdez as a moderator in the 4th National Nursing Research Webinar this September 10th, 2022. Thank you, sir.
Thank you once again for giving me this opportunity to be a
And
part.
our president. So certificate of recognition is given to Sir Jerome Babate for invaluable support or organizing the 4th National Nursing Research Webinar. So let's give a virtual round of applause to Sir Jerome Babate. Okay. And last is certificate of recognition is given to Doc Rick Ann Artemio Gadin. So our program director in the 4th National Nursing Research Webinar this day, September 10, 2022. Congratulations, Doc Rick. Okay, so we have also certificate of appreciation again to our sponsors, Dr. Brian Vasquez and Dr. Mayan Burney. Give a virtual round of applause. And now let's proceed to your evaluation. Please screen this evaluation or use your QR code for our evaluation for you to receive your certificate of participation. Okay. So again, can we have a photo opportunity for the panelists? Wait. Okay, smile. 1, 2, 3. Another one, Sir Rick. Dr. Rick, nandiyan ka ba? Dr. Rick, yan.
Yes,
Okay,
po.
1, 2, 3, smile. Okay, thank you very much. And Doc Martinez, please, can you share again the QR code? Thank you.
Thank you po.
Okay, thank you very much. This is Dr. Minyo Dalen Morales, your moderator of the day, and Mr. Christian.
And I am Christian Valdez, and thank you, everyone.
Okay, thank you very much. Maraming salamat po.
Thank you po, Sir Jerome. Thank you, Sir Rick. Good Dean, thank you. Doc Morales, thank you. And to everyone, maraming salamat po.
Thank you, everyone.
Thank you, Doc Mary Jane, Doc Elmer.
Thank you po, sir. Thank you po, Doc. Thank you po.
Yan.
Thank you, Doc.
Sana makadalaw ka dyan sa inyong mga university.
Inshallah po, Doc. Sana nga, inshallah. We'll be
Sure,
glad.
Doc.
So let's go to to Notre Dame University and
Yeah.
San Pedro in Davao, and also same university kayo, Doc?
Hindi.
No, I'm from Notre Dame University,
Notre Dame.
Cotabato City. Opo, but we have the same
Yeah.
school where we graduated.
Congratulations in your dissertation. Congrats.
Thank you.
Thank you, Doc.
Okay, also for our attendees for today, we have also the link in your chat box. Okay? Okay. So probably later we'll have the panelists and the organizers will have post-conference. Thank you, Doc Elmer, Dr.
Yeah.
Mary Jane.
Thank you, Doc. Permission to leave, Doc.
It's dyan
Bye,
sa
everyone.
San Pedro at saka sa Notre Dame.
Yes. Sige, Doc.
Yay.
Bye po.
Thank you so much, everyone.
We have we had 122 attendees. Congratulations, everybody.